Yeah, sorry, I just want to say that this is the second time recording this video, as I didn't record properly the first time. And it's not going to be very interesting because it's just sort of my shoulder. I thought I'd keep my face out of it for the sake of being anonymous. But yeah, so I'll start with my history. So basically, I'd had quite a long series of problems. My problems started after I became sexually active. I think they started for the first time. So I became sexually active and I noticed that I would have issues with getting cystitis and maybe even the occasional UTI. In every case, it would be sort of cured with antibiotics. However, you know, it would happen quite often. Eventually, I noticed that I would get pain, like a sharp stabbing pain, during sexual intercourse. To be more specific, it was always when sort of internally when the anterior wall was pressed into. This would affect me if I again was attempting sexual intercourse or using tampons, anything like that. I had a few bouts of kidney infections. We're talking about over a period of approximately 5 years. I had several kidney infections, repeated UTIs. Sometimes it would be really painful to sit down. It would be painful to wee. You know, all these kind of things. Eventually, though, my UTI problems seemed to fade out, but I was left with this persistent pain. It really prevented me from having sexual intercourse. Occasionally the pain would sort of radiate down, so it would hurt to sit down. Yeah, it was incredibly difficult. I think mentally also it was just a nightmare. I tried so many different things over the course of the years. I really mean so many different things. Antibiotics, I'd had procedures done to I can't even expect to sort of not extend but sort of widen, I guess, the urethra, urodistension, I believe it's called. I could be wrong about that. Yeah, antibiotics, all these various things, and nothing had ever really worked. So I was really at a loss as to what to do. I was very, you know, I was very young, 20, you know, my issues had started when I was approximately sort of 16, 17, and I was now at the age of 21, 22. And then I found the doctor. Just recording this video in parts in case any of it doesn't save. So yeah, so I found the doctor. I'd seen some stuff online. I think Marnie, actually from Geordie Shore, I'd seen interview that she'd done, and I was really at the point where I would have been willing to do anything. I just did not want this as part of my life anymore. Nothing seemed to work. So I think I went into Fulguration, which I did in the October of 2021, so about approximately a year ago. I went into it, you know, I was hopeful, but at the same time, I think you can never go into anything thinking it's going to be a miracle cure, I think. So I was trying to be rational about it. Yeah, so I had the Fulguration. It was quite a, you know, a heavy experience in terms of, you know, going to Istanbul, doing all of that. Quite emotionally sort of, you know, stressful, stuff like that. The actual Fulguration was fine. I found that the team were very kind. Everything, you know, on that side of things was fine. It was just a very stressful experience because obviously I'm sure a lot of people can appreciate, like, with this kind of illness, it's so difficult. You're so prepared to do things in order to help yourself, but it's like, oh my god, what if in doing this I'm doing something that's actually going to set me back, or oh my god, make it worse? So, you know, it was very difficult. But yeah, so I decided, like, yeah, that I was gonna have it done. Anyway, I had it done, and it went well. I believe that I mean, the doctor can confirm this, but you know, I had quite a lot of, my bladder seemed healthy, but I had quite a lot of leukoplakia, you know, especially around my urethra area. I think that was the issue. You'll have to confirm everything. But yeah, so, you know, all that was sort of removed. My recovery, you know, bizarrely, for the first time in many, many years, I went to pass urine, I think a couple of days after, well, not a couple of days, maybe the day after having my catheter out. And anyway, the first time I passed urine after that, I thought, oh my God, I'm weeing without any pain. Like, that felt a bit bizarre and insane, and I was thinking, okay, hang on, let's not get our hopes up now. Like, it's not wise to do so, especially as I was literally still in Istanbul. I think I'd had the surgery a day before, so, you know. But anyway, yeah, and I felt quite alleviated, I think. You know, I would pass some blood clots, or like maybe not blood clots, like scar tissue, maybe, just, I don't know, it's the things that have been removed in my bladder. I think maybe skin, excess, you know, whatever, I'll be passing through when I would have a wee. And that was quite not alarming, but I was like, oh my goodness. Yeah, so I returned home. My recovery was very sort of fluctuating. It definitely felt better, and then it felt a lot worse. I had cramps, a feeling of fullness. Around the 6-week mark, I think, or maybe possibly even later than that, maybe even a few months into recovery, actually, I developed an intolerance, not an intolerance, but the day after drinking alcohol would be excruciating pain in my bladder, not when I went to the toilet, but just almost like a cramping, searing, burning. So that wasn't great. And yeah, and I also developed a really, 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 really strong pain when I weed that would be incredibly sharp straight after passing urine, and then would sort of fade. But, you know, eventually those things, they both sort of drifted. I wouldn't be able to pinpoint exactly the point at which they'd stop, because I think it was such a gradual change. And I think it sort of did work out like that for me. It was sort of gradually, and I was so anxious. Like, every little sort of niggle that I got, a sensation that didn't feel right, I would be like, oh my God. Like, I think I messaged the doctor many times, actually, stressed that I had a UTI or something like that. But, you know, in every instance, it was sort of fine. I'd followed his antibiotic regime afterwards, and I still had lots of spare antibiotics, you know, in case. So yeah, so I followed his regime. I think in terms of sort of going back to having sexual intercourse and stuff, everything's been really fine, really normal for me in that regard, which is honestly very surprising, because it's been a very long time, many years since that's been the case. So yeah, I think I can I can only really speak for myself and my own experiences on this, because I know that you know, not obviously no two cases are the same, and I suppose yeah, I suppose I can sort of only speak for myself, but I would definitely say that for me, things have been very positive, and I would never really have imagined myself to be in this position. For example, I don't really think about illness or sickness on my bladder, whereas every day for the past however many years, 5 years or 4 years prior to this, it would be quite literally all I thought about. Especially every evening, you know, I'd spend, God, like 2 or 3 hours each night searching for answers, trawling through the internet, making lists, trying to find symptoms and stuff, and anything that would correlate, and it was just a nightmare. So it's insane, really, actually, to think I feel like my life is sort of normal, but I know, and I completely empathise with the horror that this, you know, condition is, and the stress that goes into trying to find a solution. So I can't speak for everybody, but I can certainly say that for me, it has been positive, and I hope that is, I hope for, if this is going to people, then I hope that can bring hope to some people. I don't want to have, hence why this video is anonymous, I don't want to have a responsibility of saying, oh my god, everybody should do this. Yeah, but I can share my experiences, and I can be truthful, and I can say that it has helped me. And I try not to live in fear that anything would ever return one day, because ultimately it's very easy to get sort of ruled, I suppose, by anxiety and stuff, and it's valid. I mean, gosh, it's such a long and a traumatic sort of process, going through issues with UTIs, with all these kind of things. It feels infernal, like it's never going to end. So yeah, so I definitely feel like for me, it's having the Fulguration was probably the best thing, well, definitely the best thing that I'd done for myself. So yeah, I would, to conclude, I would definitely say that I had a good experience. Recovery was difficult. It wasn't simple. It wasn't straightforward. There were lots of times when I'd thought, oh my gosh, maybe this hasn't worked, and I would think, okay, I'm going back to the drawing board, but it was never truly the case. I think I just had to give it sort of a decent amount of time to really sort of feel the effects. So yes.